My name is Gurshan Kohli from Parvasi Media, and as we all know, the situation in Brampton, the healthcare. So, what are the concrete numbers, budget numbers? How you're going to increase the budget, or how you're going to tackle this problem?
So, I will say first of all, for those of you who are following the budget over the last few days, we have a government that went from having a $200 million surplus to a $10 billion deficit in 1 year. This is unbelievable. We are spending more in Ontario than we have ever spent in the history of this province. And, you know, I would say, for me, the biggest problem with that is that I do not believe they are spending responsibly. You know, they are not spending responsibly. So, from what I'm seeing, we are spending far more dollars in healthcare that are going into shareholder pockets, shareholder profits in private for-profit clinics. The government has moved public healthcare dollars from our hospitals and our public operating rooms and into private for-profit clinics. And the reports that we're seeing now are proving what we suspected would happen, which is it is costing our system more, not less, while our operating rooms are collecting dust. So we think that the government is spending the dollars they have allocated for healthcare in the wrong ways. I want to see those dollars spent keeping those public operating rooms operational, not shutting them down to make money from other people over in private corporations. I want to see them invest those dollars in hiring more nurses, paying them a decent wage, so that we can actually provide the care that people so desperately need. And the reason I'm here today is to say I want to see them use some of those healthcare dollars, not to prop up that private for-profit healthcare system, or those private nursing agencies, but to actually invest that in giving our family physicians that are already practicing a little bit of extra support so they can spend more of their time seeing patients and less of their time doing paperwork. It's absolutely the number one issue that family physicians raise with us. It's a suggestion that the Ontario Medical Association has made themselves. The government is simply not taking action. So I believe that we are not spending our healthcare dollars in a fiscally responsible way.
Hello, my name is Janine Herman-McLeod from Brampton Caledon Health Coalition. And I wanted to let people know that we will be having a protest for better healthcare for Brampton and Caledon outside of Brampton Civic Hospital on April 22nd from 3 to 7 p.m. with Peel Paramedics and Peel Regional Labour Council. And we will also be joining the Ontario Health Coalition with a bus from Bramalea City Centre on May 30th for their march from Nathan Phillips Square to Queen's Park in order to stop privatization of healthcare. So if you would like to join us, please go to bramptoncaledonhc.ca. Thank you.